Okay, so first off, we're going to start with the dermatomes. So L1 goes here on the groin, L2 goes about mid-thigh, L3 goes lateral thigh around the patella to the medial knee, L4 goes down around the lateral patella down to the medial shin and into medial malleolus, L5 goes down the lateral shin and into the toes. Let me flick over this time for you. S1 goes from the base of the foot all the way up to the calf, and then S2 goes from the anterior calf up into the base of the butt. I have to flick it back on your back. I have to come sit down towards me. Okay, so now we'll go into myotomes. So myotome L1 and L2 both do hip flexion. So I'm going to have here, I'm going to have you lift your leg straight up. Great. L3 does knee flexion, knee extension. Apologize. So come out here, like that. Great. I'm going to scoot back into the table for me. L4 is in charge of dorsiflexion. So if you're going to pull down. Great. L5 does great toe extension. So hold your great toe. Good job. Okay, I'm going to have you stand up. S1 does ankle eversion, hip extension, knee flexion, and ankle plantar flexion. But for the test test, we're just going to be standing on your toes. So you can stand on your toes for me. Good job. Okay, have you sit back down. Now just lay on your stomach for this. And then S2 does knee flexion. So have you like this. Okay. Flexion, you're the one to pull it back towards me. Good job. Okay, now you sit towards me again. Now we'll do the deep tendon reflexes for him. L2 and L3 are partial for the patella tendon reflex, but that's not their primary. L4, however, its primary deep tendon reflex is the patella tendon. So I'm using this pen as my reflex hammer. What you would do is, obviously his legs would be floating, they would not be like placed on the ground. I would hit on the patella tendon there, and I would expect a reflex. The knee extends towards me. Okay, I have you sit back on the table for me. L5 is the tibialis posterior, so I'll show you here. So I have the foot in eversion like this, and I would hit on the tibialis posterior tendon, like that with a reflex hammer. I would expect the foot to come in and invert towards me slightly. However, obviously you're not going to see that, obviously, because bad hammer. Okay, and then S1 is the Achilles tendon, so I'll have you flip on your stomach for me. Okay, in here I'm just going to hold the base of the foot, and then I'm going to slap the reflex tendon. I'm going to slap the hammer on the Achilles tendon, expecting the foot to dorsiflex for me. But again, you're not going to see it in this video just due to my pen not being a reflex hammer. Now I'll move on to circulation. So I have your foot back towards me, T. Okay, I'm going to have a scoot back into the table. One of the things we do with circulation is we check capillary refill. Squeeze the toes, see blood fill. Clears back out, that's capillary refill. Next, we're going to do the dorsal pedis pulse. You feel on the anterior foot here. Looking for that pulse there. Next is the tibialis posterior pulse, which is going back here. There. Okay, I'm going to consider at the end of the table for me. Next is the popliteal pulse, which is back here on the popliteus. Feel back in there. Okay, and then the last one, I'm going to lay back on the table. It's the femoral artery, which you're going to feel in here and feel there, the femoral artery.